Greetings to Dental XP members. This is Dr. Udatta Kher from Mumbai in India. I would be demonstrating a transcrestal sinus augmentation procedure using osteotomes and a very unique delivery system for placing the graft, which is a calcium phosphosilicate, in a putty consistency. This is the preoperative baseline situation. We start the procedure making sulcular incisions. As you can see, the tooth that needs to be replaced is the second premolar. A number 12 blade is being used here to make sulcular incisions. We then make a crestal incision in order to gain access to the alveolar ridge. Periosteal elevator is being used to raise a full thickness mucoperiosteal flap. Since this is a transcrestal approach, no releasing incisions were made in this case. The preoperative evaluation has been done, and based on that we go ahead with the starter drill, keeping it 1 millimeter short of the assessed height of the residual ridge. In this particular case, the height of the residual ridge was 8 millimeters, so we kept the drill a millimeter short of it. So this is the starter drill. We then go ahead and widen the osteotomy using a 2.5 millimeter depth drill. Again, just widening the osteotomy but keeping it a millimeter short of the floor of the sinus. Further widening is done with the help of a 3.2 millimeter drill. Again, the widening is done at relatively slow speeds of 600 RPM, and again keeping it a millimeter short. Once that is done, a 3 millimeter osteotome is introduced, and then using gentle taps with the mallet, the floor of the sinus is fractured. Following that, the graft material, that is calcium phosphosilicate putty, is gently introduced with the help of this unique delivery system. It's extremely convenient to place their material inside the osteotomy side, and because of the hydrostatic pressure of the syringe, it also helps to push the sinus lining further superiorly, and thus gain the desired lift. Some more material being introduced. Following that, a BioHorizon tapered internal implant is being used uh, into the osteotomy site, which is being set at 35 Newton centimeter torque. The implant is being placed inside the osteotomy site under very sterile conditions, ensuring there is no contamination of the graft or the implant surface. As you can see, the implant has been placed up to its final position. It's achieved good primary stability. The cover screw has been placed, and a 4-0 monofilament is being used in order to achieve good primary closure. This is the immediate post-operative radiograph. As you can appreciate, the amount of graft material around the apical end of the implant and the tenting effect that has been caused with the help of the calcium phosphosilicate putty. The phase 2 of treatment was done after 4 months. Second stage surgery was performed, impressions were made, and a screw retained restoration was fabricated, uh, adjusted, and then finally torqued at 30 Newton centimeters. And this is the final post-operative result. As you can appreciate, a good amount of bone fill, and in the end, a good outcome. Thank you for your attention.